Hello, and welcome to the Health is the Key podcast, where we explore the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. Anyone who has seen a doctor recently knows that the way healthcare is being delivered is changing rapidly. The new thinking is that we're all more than just the sum of our parts. More and more medical professionals are treating the whole person, not just a collection of symptoms or a diagnosis. It's actually an idea the benefit funds have long embraced. 1199ers have access to some of the best health coverage in the country, and they also have the resources and tools that empower them to get the care they need. Through our Healthy Living Resource Center, health fairs, webinars, and workshops, members can find the support they need wherever they are on their health journey. So we're excited to talk about this unique approach to wellness with today's guest, Dr. Chiti Parikh, Executive Director of Integrative Health and Wellbeing at NewYork-Presbyterian Hospital, Weill, Cornell Medicine. Welcome to Health is the Key, Dr. Parikh.
Thank you so much for having me.
So the Integrative Health and Wellness and Wellbeing program that you co-founded, it combines Eastern and Western philosophies. And we read that Western medicine is sort of defined as the absence of disease, but Eastern medicine has a much broader view. Can you explain that a little and how that all ties in with the Wellbeing program?
Absolutely. So what you just mentioned is really key. You know, there's a saying by Osler, I believe, that says a good doctor treats the disease and a great doctor treats the patient. So two people can walk into my office and have the same diagnosis, right? So before I saw them, if I just saw their computer, like the chart, I would know what diagnosis they have, what symptoms they're coming in with. But when I actually see the patient and when they walk out of my office, often the treatments are completely different, even though the diagnosis could be the exact same. That's because the diagnosis is often just limited to our physical symptoms. But we all know that we're more than just our physical symptoms. So it's important to look at not just physical, emotional, spiritual, environmental health, also social health. You know, how do we fit into our community? What kind of support system do we have can be instrumental in the success of the treatment plan I'm prescribing. So if someone lives alone, doesn't have any resources, doesn't often cook their foods, and I'm sitting here talking to them about all these nutrition plans, right? Then I have to take into account all of these other aspects of what makes us who we are. So holistic medicine, integrative medicine is looking at the individual, and going the step further is customizing the treatment based on what their unique needs are.
And so how so many doctors approach their medicine for personal reasons. So do you have a personal journey that led you to integrative medicine?
Yeah. So, you know, I grew up in India. So growing up, I still remember anytime I got sick, my grandma would be like, just come into the kitchen, opens up the spice box and puts together some concoction. So that just sort of stuck with me. I grew up knowing that food is medicine. So, and I really embraced it in my personal life. And then before I started medical school, I actually took a year off. I wanted to spend some time learning more about myself and also the profession I was about to, embrace for another decade of school before I get into that. I wanted to just take some time for myself. So I ended up backpacking alone through Asia for a year and traveled to all far corners of these countries and really meeting the people, learning about the traditions, the indigenous medicine, met monks who are meditating, participated in meditation retreats to experience these things firsthand. And what I found was that health and healing is so much more than just the medicines that we take, right? It's a bigger conversation. How we heal is a reflection of how we live our life overall. So it just opened my eyes to what was possible when we talk about what a doctor does or a healthcare provider does. It really expanded that definition. So how I grew up, my travels, it really shaped how I practice medicine today. And I'm so glad, I'm so grateful for those experiences because it opened my eyes to understanding and connecting with people at a level that was way more meaningful and impactful.
So when you began your medical career, you began with that intent.
Exactly. And I always embraced those practices myself. So, going through residency was a grueling time. I still remember, when I was working in the ICU some days, I had no time to eat and I was losing weight. So I would hide in the bathroom and I would chug cans of Ensure because I did not have time to eat. And so, reflecting back at those days, and I'm like, oh my God, and I'm here as a doctor telling people what to eat,
Right.
So, after residency, I spent a year just focusing on my well-being and bringing my body back to balance after everything I had been throughout residency. So I started fixing my diet, exercising, meditating, yoga. And then I realized that, hey, if I'm doing these things for myself, why am I gatekeeping this information for my patients? I know it helps. I know it works. The science supports it. So that's what drove me to say, this is the path forward for me. And I want to bring a truly holistic model of care for my patients, where I'm combining the best of cutting-edge Western medicine and bringing in the ancient wisdom all together, so no one has to choose one or the other. We can do both.
I wanted to ask about, in conventional medicine, we've all gone to doctors our whole lives, and they've said, eat more healthy, exercise. So what makes this different? What makes the whole person approach different than going to your doctor and saying, you should move more?
So we've all been there, right? We've all been in a doctor's office, handed a piece of paper saying, walk your 10,000 steps and eat this diet, right? I still remember this one day. I was working in the hospital and I was taking care of patients who just had a heart attack in the ICU. And I remember one of my patients had a diagnosis of diabetes, heart disease, high cholesterol, which a lot of people do nowadays, right? And as I was discharging him, it printed out this automatic diet he was supposed to follow. And I took a moment to look at it, and it basically said, follow a low-fat, low-carb, low cholesterol diet. And I thought about to myself, it's like, if someone gave that paper to me as a doctor, I wouldn't know what to eat. Like, do you eat cardboard? I don't know what's left, right? Or do you just eat grass? I don't know. So this goes to show you that, unfortunately, what we're doing currently is just telling people, follow a healthy diet and exercise. But we all have unique circumstances. We all have different needs. So until we take the time to customize these recommendations, I don't think we'll get sustainable results. Mm-hmm. So holistic medicine takes into account each individual's unique needs and customizes a treatment to say, you're working night shifts. Okay, so let's figure out, how does your diet, exercise, sleep, how do we customize it to your routine? You're taking care of 3 kids and you have a 2-hour commute. So let's figure out, you're not going to have time to cook every single day.
We know that nutrition is a huge part of this, but there are more aspects to holistic care. Is one more important than the other? Can you run through those and let us know how you approach each?
Yeah, so we start with usually 4 fundamental pillars that applies to everybody. So we talk about nutrition, diet, right? The other one is sleep. The third one is exercise or just movement. And fourth one is stress management. I love to focus on stress management first because I find that when we're stressed, we're not reaching for a kale salad, right? We want that Snickers bar. Even if we know everything about nutrition, stress really changes our food choices. So it's important for me to address stress first because when you're stressed, you also don't have the energy or motivation to exercise. You're also not sleeping properly, probably, right? And especially when we talk to healthcare workers, people in stressful jobs, we know that stress is often unaddressed, right? When you go to a doctor's office, they might say, if you're stressed, you need to just see a therapist, which is important, or do this. But there's no concrete plan to address stress in Western medicine, right? So that's why I love to focus on that first, because I know when stress is better managed, all of the other things like sleep, exercise, diet will be far more effective and easier for the person to stick to.
Oh, that's a great point. I hadn't thought of that. So, and this probably is not the right question, but because people are so different, what would a typical treatment plan, if there is a typical treatment plan, for someone who's comes into your program?
Yeah, so let me walk you through what the journey looks like. We typically work with patients for 6 to 9 months. So this is sort of a deeper dive into your health, your lifestyle, and we're doing it in a way that is sort of concrete. So we want to put timestamp around it, right? Because our goal is to give you all the tools that you need. It's not about fixing a disease or a symptom. It's all about empowering you as a patient so you have all the knowledge you need to take better care of yourself. So in my first visit, when I meet a patient, we usually spend about an hour or so together. to really get to know each other better. And besides the usual medical history, surgeries, and allergies and medications, we go through that too. But a lot of time is spent on really understanding what are the barriers. First of all, what is your goal? And what are the barriers you've encountered until now? So then I can keep that in mind as I'm thinking about a treatment plan. So when it comes to diet, we talk about not just what you're eating. I focus a lot on timing of meals because the studies have shown that's far more important. When we talk about exercise also, it's not just about going to the gym. It's like, how are you incorporating activity throughout your day? So these are sort of the details we really go into in our visit. And then what we do is we take one step at a time. And some people need more help than others. Some people have done a really good job in one area. They might need more time with the other. But we take time to hit all 4 of those domains. So often my first homework for my patients when I first see them is very simple. I ask them to write down a daily routine for themselves. So one of the hardest things I find for people is not that about eating a healthy diet or exercising, is a lack of routine. So if every day looks different, it's hard to get into a habit because all of these things need to be part of our life. And also the other thing is when it's not part of our routine, it adds a lot of mental load for people, right? It's like, when am I going to find time to eat? When am I going to find time to work out? When am I going to bed? These are decisions you have to make every single day. So my first order of business is let's pen and paper, let's write down what time do you want to wake up? What time do you want to go to bed? What time would you like to eat your 3 meals? Because here I am talking to you about diet for an hour and then realize you don't even have time sometimes to eat a healthy healthy meal at lunch. You're skipping it. So that's why something like a schedule, a daily routine is the first thing I focus on. And then we add on the additional pieces depending on the person's needs.
Okay. What you had brought up there, everyone's different schedule. What are the typical challenges that you find with patients? Like, what are some of the barriers you have to help them over?
So often nowadays when we talk about health or wellness, you go on social media, you watch the news, there's this idea of perfection that is often presented to us to say, to be healthy, you have to drink your green juice, you have to, meditate every day, exercise, you have to have a 6-pack, you got to run a marathon, you have to be a certain size, you have to look a certain way, like all these unrealistic expectations are set in the name of health and wellness, when we know a lot of this is not true. Everybody is different. So that's one of the reasons why I focus on these individual goals, like what health means for you. Let's focus on that first. That's going to define our journey. It's not about matching an idea that's set forward. So I think that's the biggest challenge for people, is that they feel like they have to do all of those things and they have to do it perfectly. If they don't do it, then they're failing. So imagine having to accomplish this impossible task every single day and then you always feeling you're failing. And then you say, what's the point,
It's all or nothing.
It's all or nothing. So that's one of the main things I focus on, is say, let's prioritize. So my job as a doctor is to help you prioritize things that are affecting your health the most, or how do I help you get to that goal that you just set for yourself? So I can do that work for you in the sense, let's say, priority is sleep number 1 for you, because that's what's really affecting your body right now. So let's just focus on sleep for this month, right? So by doing that, I'm taking a lot of pressure off, and I'm also guiding you, because no one can do this on their own. We all need help. So I see my job as being that guide and helping you prioritize tasks and figuring out how to get these things done in a sustainable but realistic manner.
And that's what I wanted to ask you. How much contact do you have with the patient over the course of treatment? And do they have access to a coach or something like that keeps them going?
Yeah. So typically around 6 to 9 months, we might meet for 3 to 4 times. And a big part of our practice currently is one-on-one consultations, but we also have a very robust group program. So these programs are focused on different topics, from metabolic health to gut health to mental health. So when I see a patient and I realize their focus is to bring down their blood sugar, to lose some weight, then okay, let's get you into the metabolic health program, which is a 1-month program. It's virtual, covered by insurance, the same as doctor's visit. So what that does, it gives you more opportunity to immerse yourself and understand your body's unique needs, and also embrace a treatment plan that is practical. And then they can circle back with me after that month of group program and say, okay, let's review your data. Let's review your blood test again, your blood sugar data, and see what kind of progress you made and what needs to be tweaked. So that's how we work, is we'll do one-on-one consultation, then group programs in between, and then continue to follow up during that time. And at the end of our 6 to 9 months, we come up with a list, essentially. We talk about which diet is most appropriate for you, what are the blood tests you need to follow up with your primary care doctor in the future, what type of lifestyle changes, stress management tactics that work best for you. So you have that as a reminder, something that you can go back to anytime you need to.
Okay, so it's sort of self-driven. And you had mentioned earlier group support. Is that peer group?
These group programs are run by physicians, and sometimes you'll be a physician plus another provider. So either a dietitian, a meditation instructor, a qigong instructor. So our goal is to really make all of these services available to as many people as possible. So often what happens is sometimes if you're waiting to see a doctor, it might take a long time. There might be a wait list. So group programs are our way of bringing a lot of these services to as many people as possible. And also, you get an hour with the physician. So sometimes that's more time than you'll get with any doctor, right? So, and it's also good for the provider. As a doctor, I would love to talk to a group. And that group dynamic, research studies have shown, is also extremely therapeutic. So they've done studies looking at group programs in different, academic medical centers, and they found that people actually preferred them sometimes. And they had almost 20% better enrollment engagement than one-on-one visits because people learn from each other. It developed a sense of community. And most importantly, people did not feel alone in their journey. Because often when you're diagnosed with something, you feel like, where do I go? Who do I turn to, right? So it's nice to have a group that's going through something similar. And I love that group dynamic because sometimes, I'm always learning from my patients. So a lot of interesting stuff comes up. I'm like, I need to make a note of this next time we're talking about this topic. So it's fun for me. It's fun for patients. And I think there's a lot of therapeutic benefit to it as well.
And our 1199 members are a very tight-knit group. And they have, we even have in our Weight Watchers group, we have 1199 our only Weight Watchers group. And they get a lot of, you do learn, you get tips from each other, you get support when things are going rough. So, yeah, that's really important. Now, I want to talk a little bit about your book. You just came out with a book called Intentional Health. And when our executive director, Dr. Ray, launched our Healthy Living Initiative, she thought it was very important to ask our members, what is your why? Why are you starting your health journey? And you have something similar in your book to what is your intention? Now, can you explain a little bit about whether that's the same thing and why it's so important?
So I think about setting an intention is like putting instruction into a GPS, right? So if I want to go somewhere, I need to put that destination in my GPS, and then it can figure out a path that's most suitable for me. That's the fastest way to get there, right? But if I don't give that specific instruction, we're going to go around in circles. And often what I see in patients, that's what happens. If we don't have a clear intention, we say, okay, I watch something that talked about a keto diet. So I'm just going to do a keto diet for a month and let's see if that helps me, right? But there's no clear why. Why am I doing this? What am I looking out of it? What I'm looking to get out of it. And then you try it. Maybe you lose a few pounds, you feel good, and then you go back to your usual diet, right? So the question is, why don't we set an intention first? Ask what is most important to me? Why am I doing this? What am I looking to get out of? And studies have shown that there's actually a very important benefit to this because when we're setting an intention, it actually sets our subconscious into motion. So it actually drives how we're thinking. It actually avoids a lot of negative self-talk that often happens when we're trying to achieve a goal. And it directs our behavior in ways that we're not even thinking about. So studies have shown that people who are actually very clear about their intention or goal setting, they have much better outcomes. They have much better adherence, much better compliance. They're actually sticking to what they're trying to do throughout the journey and not dropping out or not giving up. So there's a lot of benefits to setting an intention. And also, it puts you in charge. I feel like, who am I as a doctor to tell you, no, you should be focusing on your diabetes? No, but that might not be as meaningful as for you. It might be like, I want to be able to be fit enough so I can chase my grandchildren. Like that's probably your goal. So let's focus on that, right? So when we change our language and change our narrative to something that's meaningful to us, there's nothing that's going to motivate us more. So that's why I love starting with an intention.
And that's interesting because a lot of our members say their intention is to be around for my children or play with my grandchildren. We wondered, is there such a thing as a misguided intention? Is there any time you have to talk a patient out of it? Like, I'm doing it to keep my mother happy or something like that.
Yes, that does happen sometimes. And again, that comes back to our conversation I just had about the expectations that are set by us based on what we see in social media or news, right? So some people might say, I want a 6-pack or I want to lose 100 pounds. Great. Those are all great things. But bigger question is, why do you want to do that, right? So you can get there many different ways, some healthy, some unhealthy. So the question is, what's the bigger picture? Do you want to feel stronger? Do you want to feel healthier? Do you want to feel like you have more energy? So let's rephrase that goal, that intention, in a way that's more meaningful and that's more personal.
So you work with them to
exactly to navigate that, because we're all learning, right? It's a skill that we all have to learn, and we're here to help.
You must get a lot of patients who are used to traditional Western medicine. So how open are your patients when they come face to face with this approach?
They're actually very, very open. I've been very pleasantly surprised that I don't have to do a lot of convincing and talking. People actually seek it out because a lot of people experience that firsthand. They know that my physical symptoms, what's going on with me, is definitely influenced by stress. If I don't get enough sleep, if I am, in an environment that's not facilitating my healing, I get worse, right? So they know these things. But sometimes when they go through the regular doctors, they're just like, let me look at your blood tests. What prescription do I have to give you? Which is important, but they often feel like, no, there's something more I should be doing and I can be doing.
So they're looking for deeper answers.
Answers, exactly. So they are seeking out providers who can look at them more holistically and give them more choices and options.
Well, that's great. Well, you've given us quite a lot to think about. So if there's one takeaway that you could leave our members with today, what would it be?
Routine. I'm telling you to do your homework, just like I tell my patients. Pen and paper, write down, what time do you want to go to bed? What time do you want to wake up? And I understand sleep can be elusive for some people. So it's not guaranteed you're going to fall asleep at 11, but at least get in bed. Get your body ready for sleep.
Well, that's it. I'm getting out my pen and paper. Well, thank you so much for taking the time to meet with us, and you've been great. We appreciate you.
Thank you so much for having me.
To learn more about Dr. Parikh's book, Intentional Health, tune into this month's keynote. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.